Hello everyone. So today I'm going to talk about alcohol dependence, and this is another video in the Psychiatry for PEP 2 series. So suppose you have a patient who is alcohol dependent and he is presented to you and he wants to quit drinking alcohol, or you have a patient who is presented with some other problem, but you found out that he's drinking a lot of alcohol and you want to talk to him about his drinking habit and you want to offer some help. So how to proceed with such type of situations? So first thing is history here, how to approach the history. The first part of the history will be asking journal type of questions about alcohol consumption. So what type of alcohol are you drinking? Since when have you been drinking? How much do you drink? Do you drink every day of the week? Is it the same amount throughout the week? And how long have you been drinking this amount? Okay, because there are different types of alcohol and they have different type of strengths and you have to count the units of alcohol. So these questions are important. And since when the person is really drinking, and how much is he drinking? How much is he drinking, and is he drinking every day of the week? And is it the same amount throughout the week, or he's drinking more on weekends? All of this information is important when you are going to provide the management. Okay, and how long have you been drinking this amount? Okay, so for example, he's drinking 20 units per week. So how long has he been drinking these 20 units per week? Okay, then the next part is establishing the dependence, whether this person is actually and truly dependent on alcohol, and how severe is his dependence. So for this, we have the criteria of KHTWD, which is basically an acronym. And here C stands for cutting down, A stands for annoyance, G stands for guilt, E for eye opener, T for tolerance, withdrawal, and dependence. So these are a series of questions that we need to ask in order to establish whether a person is dependent on alcohol or any other drug. Okay, so cutting down. So in cutting down, we'll ask the patient, have you ever tried to cut down the amount of alcohol that you have been drinking? And if yes, when was that? And how did he try? Was there any professional help, or did he try to do it on his own? And what were the reason in the patient's opinion that it failed? Okay. Then annoyed. So you'll ask the patient, do you feel annoyed when people talk about your drinking habit? Eye opener. So you'll ask the patient, do you need to drink alcohol early in the morning in order to start your day with? Guilty. You'll ask the patient, do you feel a little guilty because sometimes you drink a little bit too much? Okay. Tolerance. Do you need to drink more and more in order to get the same effect? So that is tolerance. Because the patient, a person who is dependent on any drug, he gets, kind of immune to the same amount, and he doesn't get the same effect, the same high with the same amount of drug, so he keep on increasing it. Okay, so this is one indication of dependence. Then dependence, do you develop any symptoms if you don't drink for a day or two? Okay, so for alcohol, when a person doesn't drink alcohol for a day or two, we can develop withdrawal symptoms, which are anxiety, agitation, restlessness, itching, diarrhea. Okay, and the worst of all will be seizures. Okay, so make sure that you ask about seizures, because this is a red flag. Okay, this is really a red flag for you. If a person develops seizure when he doesn't drink alcohol for for some time, and this entirely changes your management. Okay, then you need to okay, so before going into the risk factors, I want to tell you that these are kind of very intrusive questions that you are going to be asking from a person. So if the person is presented voluntarily to you and he wants to, and he tells you, the doctor, I want to quit drinking alcohol, then it is fine. But if you have another patient who has presented with something else, but you want to talk about his drinking habit because you are concerned, then you need to, you can't directly jump into asking these questions, what type of alcohol and since when and the KHTWD, because more often than not you will offend the person. So before jumping into it, kind of ask other questions, maybe some questions about his medical illness that he is presented with, how has he been doing, and ask the questions of lifestyle, like uh, cigarette smoking and food and exercise, and then come towards the alcohol, and maybe talk about alcohol in detail there. So you need to kind of do it a little bit diplomatically. Okay, risk factors. So now you need to find out the risk factors, why the person has been drinking this amount of alcohol in the first place. So you'll ask, is there any particular reason for you to drink? Any particular reason that has been pushing you to drink more and more? Okay, and how is your mood? Okay, so you need to find out whether the person is depressed or not, because sometimes people with low mood, they tend to resort to drugs to, kind of numb their senses and not to feel anything. So you need to find out whether the person is having any mood problem or not. Then you will ask about the medications, allergies, and any medical condition at all, and the social history of the person. What is his job? Who does he live with? How is this alcohol drinking habit affecting his job? How is it affecting his finances? How is it affecting his relationships? Okay, so social history is also really, really important here. Okay. And then you need to ask about ideas, concerns, and expectations. Expectations, whether he's expecting any particular sort of help from you today, and is there anything that he's concerned about, any fears regarding the quitting process, etc. Then you need to do examination. And examination, you will just do the vitals and the GPE. In management, you will you'll tell the patient that we are going to give you some medications to prevent the withdrawal symptoms, okay, and that will be chlordiazepioxide. Okay, so you'll tell the patient that will give you some medication that will prevent the withdrawal symptoms like anxiety, itching, restlessness, agitation, etc. And we'll also give you a medication to reduce craving like a camprosate. We can refer you to psychologist for talking therapy, and he will work on the basic reason of why you are being inclined towards drinking too much, and he will help you to cope with the urges. And you can also join a support group called Anonymous Alcohol Anonymous, where people who have lived through similar problem will help you with your journey. Okay. And you'll also tell them that if any time you feel like you need to talk to someone about your drinking and you are feeling overwhelmed, then there is a national confidential helpline, and we can give you their number. And anytime you are feeling overwhelmed, you can just call on this number, and there will be someone available to talk to you. Okay, and then provide you support. So this management was about a patient who's dependent on alcohol, and the withdrawal symptoms are mild, like itching, anxiety, etc. But if you have a patient who, you know, get seizures when he's trying to quit drinking alcohol, then you will admit this patient, okay? Or if the patient has not taking, like if the patient is trying to cut down on alcohol consumption, and he has not been taking alcohol for the last, say, 24 hours or something, and he has a history of seizures in the past, then even you will call ambulance or hospital transport for them to take them to the hospital as soon as possible, so that they don't get seizures in the hospital. What they will do, they will give them diazepam. They will first stabilize them and start them on a composite, and the rest of the management will then be same. Okay. Alcohol units. So alcohol units, talking about alcohol units is really important, because you need to know how to calculate alcohol units so that you can tell whether the patient is consuming more than the safe limits of alcohol or not. Okay, so according to NICE guidelines, safe units of alcohol are less than 14 units in a week. Okay, and it should be divided throughout the week, not all of the 14 units on a single day. Okay, so less than 14 units in a week is the safe limit. Now we have different types of alcohol. We have wine, we have beer, we have spirits, and all of them have different strengths of alcohol. So let's talk about it so that you are able to calculate and tell the patient that you are drinking more than the safe limit. So for wine, one glass of wine has 3 units of alcohol. Okay, and one bottle of wine has 3 glasses of wine. Okay, so 3 into 3 makes 9 units. So if a patient is drinking 1 glass of wine, it's 3 units. If the patient is drinking 1 bottle of wine, it's 9 units. Okay, a beer. So 1 can of beer or 1 pint of beer is 2.5 units of alcohol. Okay, so if a person is drinking 2 can of beer or 2 pint of beer, then it is going to be 5 units of alcohol. The highest strength alcohol are the spirits, which are vodka, whiskey, and rum, etc. So one shot of the spirits is 1 unit. Okay. So a person is drinking one shot of vodka, that is basically 1 unit of alcohol. If the person is drinking one bottle of these spirits, then one bottle contains 30 shots. And this means 30 units of alcohol. Okay. So for example, if a person comes to you and he's been drinking one bottle of these spirits, for example, one bottle of whiskey over the week, so that will mean 30 units, which will mean that the person is drinking more than the safe limit. So we'll tell the patient that the safe limit of alcohol consumption is 14 units over the week, but from what you have told me, seems like you've been consuming 30 units of alcohol over the week, which is way more than the safe limits, and that's why I'm concerned about you. Because if you keep drinking this much amount of alcohol for a long time, then you will become dependent on it, and it will have detrimental effects on your health. It cause damage to a lot of organs in the body, including your liver, and it can badly affect your life in general, your job, your finances. So that's why I'm concerned about you, and I want to offer help, and there's a lot of help that is available on the NHS. Would you like to discuss it with me? So, this is how you are going to approach your alcohol dependent scenarios, and I hope it was helpful. And I will soon see you with another video um, about smoking cessation counseling.